Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast.
Hello, once again, good people. This is Dr. Keith, and this podcast is called Destroying Diabetes, where you get to talk and listen to me. Again, someone left the door open and let me in, so I guess that I'm doing okay. So they let me do another podcast. So they haven't locked the doors on me yet. So I'm going to take advantage of this time. I don't know how long it's going to last until they throw me out of here. Thank you for listening to the podcast. Please, if you can add a comment, give us a review, that will be really helpful, and just spread the word about this podcast, because this is some good information that's coming, especially if you have type 2 diabetes, or you may have a loved one that has type 2 diabetes, or someone that may be even in pre-diabetes. There's a lot of good information that I think is very helpful. And that's the reason why I'm doing this podcast, because I want to help you manage your diabetes. Don't be afraid of it. Embrace it. And please don't think of it as a death sentence. Millions of people live with type 2 diabetes and live very productive lives. So don't think of it as that. Just think of it as just another challenge that you can manage. You can manage with just armed with information. And that's what this podcast tries to provide, some good information for you. Also try to help you develop some good strategies. That's usually what I try to bring guests on, to give good strategies about mindset, ways that you can deal with some of the challenges that you have with type 2 diabetes. And just also just to be informed, and you can inform others, hopefully. Don't have to keep this podcast to yourself. Let your family and friends know about it. If you see some information that might be valuable, please let them know about it. If you have any questions, please have my email in the show notes. Please don't hesitate to send an email. No question is too small. It's too silly. Please, if you have any questions about type 2 diabetes, or you know someone that has any questions about type 2 diabetes that you may not be able to answer, or may not feel comfortable answering, just send them my way, and we'll deal with it. If it's something that you want us to address on the podcast, please send us an email as well. We always are looking to do different topics, especially topics that our listeners are interested in, because we're doing this podcast for you. So, and you're part of this podcast. So I would really appreciate any feedback, as far as any suggestions, as far as topics that we may have not covered, or maybe something that you would like for us to cover again, or a guest that's been on, you may want us to have that guest back. Just let us know. The reason for my podcast today, my topic is we're getting ready to get into cough and cold and flu season. Is coming up faster than you know. By the time this podcast gets on, it should be early October, I'm guessing. So we're just on the cusp of cough, cold, and flu season. And I just want to address some things today that's particular to anybody, but especially type 2 diabetics. That as a type 2 diabetic, you have some extra challenges during the cough and cold season. Mainly, what we talk about all the time is that type 2 diabetes usually can be traced or produces a significant amount of inflammation. And the type of inflammation that is produced with type 2 diabetes is not the normal inflammation, which like if you get a cut or something like that to help heal, like a cut or a wound, which that's the beneficial inflammation. Unfortunately, with type 2 diabetes, the inflammation that develops is not beneficial. And in fact, it taxes like your immune system. And therefore, type 2 diabetes patients tend to be more at risk in contracting communicable diseases because of the assault that the inflammation does to our immune system. So yeah, you're just more at risk. That's something just to bear in mind than someone that doesn't have type 2 diabetes. So bearing that in mind, probably the most important thing that you can do to get ready for cough and cold and flu season is to get updated on your vaccines. There's a new COVID vaccine that's available. I definitely recommend type 2 diabetic patients that you jump on that as soon as possible, because you would like to try to get your COVID shot before the weather starts really turning cooler, and the COVID virus, as we've seen in the past, that is more, for whatever reason, seems to be more communicable during the colder months. So you want to go and get your vaccine now. Even if you've had it before, this new one is more in line with the variants that are out there now. So the variants that are out there now appears to be from the data that it may be less severe as far as symptoms than some of the previous variants, but is more communicable and spreads more than the most recent variant. So it seems that there's more people are catching it, but the symptoms are not as bad. So, but still, with type 2 diabetes, you don't want to get it, no matter what kind of variant it is. Because with type 2 diabetes, like I said, that part of the problem that's caused by the high insulin is the increase in inflammation. And this inflammation leads you to be more at risk for diseases, and that we have seen through the various studies that have been done on COVID patients that the more inflammation that a patient had, a lot of times the worse the symptoms were, especially before we had a vaccine, or people that were like unvaccinated. The severity of their symptoms were a lot greater if they had diseases that were due to inflammation, such as arthritis, heart disease, type 2 diabetes, that those patients fared worse than patients that did not have those type of diseases. So you definitely want to get that updated COVID vaccine. Now, it's a little different than what it was in the past. Now that most of the government is no longer, in most cases, there's a few exceptions in like some free clinics and stuff where they still are providing the vaccine, but for the most part, they're no longer paying for the vaccine anymore. So now you have to get it through your health insurance, and most health insurances that I'm aware of so far, that they still are covering the actual vaccine, but you have to get it through your health insurance. And you want to probably just make sure that your health insurance make sure that it covers it, or if there's a copay, that you know what that is before you get the vaccine. So you may want to call like your health insurance company. Usually, like I said, the best source of information is usually on the back of your card. There's usually a customer service number, which you can call, and usually they can pull up that information and let you know if the vaccine is covered and if there's a copay, how much it is based on your plan. So you want to have that before you before you get your COVID vaccine updated, just so you have an idea. Make sure that that is covered, or if it has a copay, that you know what it is before you get your shot, because you don't want to go in and find out that your insurance doesn't cover the vaccine, and then you have a hefty price tag that you have to pay for. So you want to make sure that you get that before you get your COVID vaccine. Make sure that you know the status of that. Also, the second thing is, of course, is the annual flu shot. Now, that flu shot changes every year, so getting it one year doesn't really help you in the next year, because when they develop the vaccine, they develop what they think are going to be the most prominent strands from the data that they get from, a lot of times the data they get is from like Australia and New Zealand, the countries that are below the equator, because their seasons are different. So they've already had their winter. So a lot of times they see what strands develop there, and they use that to kind of develop the vaccine here based on kind of like what were the most popular strands, anticipating that that our flu season will go similar to their flu season. So and it's not always 100%. A lot of times it may be like 30 or 40% even on a good season, because they really are just basically guessing which strands are going to be most prominent. Then, of course, mutations happen, between the seasons, and sometimes a strand may pop up that that's not covered by the vaccine. But even if you have the vaccine, even if that strand comes up that's not covered by the vaccine, it still is better to get the vaccine, because even if you do contract the flu, usually because you have some antibodies available, that the symptoms are not usually as bad if someone is unvaccinated. So you want to get the vaccination regardless of what strand comes up. And needless to say, just like COVID, with flu, type 2 diabetes is the symptoms usually can be more severe in type 2 diabetic patients than patients without type 2 diabetes. The biggest thing is that usually when you have like a viral infection, usually it may increase like your body temperature, and that may affect like your blood glucose levels. I know with my own experience that a lot of times if I get like a cold or flu or something like that, blood sugar levels are usually a little more unstable. So one of the things I would recommend if you do get sick is that you check your blood glucose probably more often. If you're someone that just checks it once a day, like in the morning, fasting, you may want to check it like 2 or 3 times a day while you're sick. So just to sometimes just being sick may elevate your blood glucose level. And other times what may happen is that because you're sick, you're eating less, and you may lose your appetite. And then the other way may happen. You may have like more low blood sugar levels than usual, because that you're eating less. So there's less insulin having to go out, so that you may have like your blood sugars may be lower. So you have to watch your blood sugar levels. They can go either way, just kind of based on what condition that you're dealing with, and also like like your appetite, what you're eating, the medications that you're taking. Um, Usually, you just will take your medications the same unless directed otherwise by your doctor. Like if you continually see like low blood sugar levels, you may want to, if especially if you're like on insulin, you may want to decrease your dose while you're sick. And conversely, if your glucose levels are running higher, you may want to adjust it upwards a little bit if you're taking insulin until like you're till you like you feel better. And that's why the importance of checking your blood glucose, especially when you're sick, is really important, because then you can kind of manage if it's running lower than normal or if it's running higher than normal. Now, if it's just a few points either way, just continue to take it like you've been prescribed. But I'm talking about like a significantly lower, like you're getting blood glucose levels, say below 70 consistently, or if you're getting blood glucose levels and you haven't really eaten there, if it's fasting, if it's above like 120 or 130, if it's like 2 hours after you eat, it's constantly above 200, then those are blood sugar levels that you need to be concerned about. So basically, so the thing is now the flu vaccine is readily available. You can get it in most doctor's offices, most pharmacies, most urgent care places. So it doesn't look like it should be any kind of supply issue. So I would recommend that you get it now that it's October. So usually it takes a couple of weeks to fully build up. So you want to have it built up preferably before the end of October, so that you're going into the holiday season and you have a full level of immunity built up by then before you go into the holiday season. Just like with the COVID vaccine, you want to try to get that done this month too, so that you want to go into November, which is really the start of the cough and cold season. And then also you have the holidays coming up where you're around more people in close settings, family, friends, people coming from different places and stuff like that. So you want to really have your immunity up going into the holiday season. Because like I said, blood glucose is just something you really have to manage, because with any kind of diseases, with COVID or the flu, you get that on top of having unstable blood glucose levels, you can find yourself in a bit of a mess. So, and also if you have COVID, because you're like a type 2 diabetic patient, most of the time, in most cases, that the doctor may prescribe Paxlovid. And that's antiviral that you'll take over a course of a few days as directed, up to 5 days as directed. And then usually, if you have a negative test, afterwards, you can usually go back to work or go back to school and go back into society. But you'll have to talk to your provider as far as when you can resume your normal activities. So you can't always depend on just like symptoms, because you may have very little symptoms, but you may be, highly contagious. So you can't just go on symptoms. You just have to really go and get your COVID test and just continue to check and make sure that you have negative results before you start resuming normal activities, even if you feel okay. So, like I said, because the type 2 diabetes is a disease which produces inflammation, and bugs love inflammation, whether it's a COVID or a flu or pneumonia, and I'll talk about a little bit, RS, RSV. So you got to really take care of yourself through that. And I'm just urging you to go ahead and get that now. Get these vaccines in your system before you start cough and cold season, because you're at higher risk being a type 2 diabetic. You're at higher risk for a lot of things because of the inflammation, but with these diseases, they can be a lot worse with a type 2 diabetic patient than someone that doesn't have type 2 diabetes. So I definitely urge you to just get these vaccines as soon as you can. This is the month. This is the time to get it. It's fall. It's, the weather's going to, in most places, it's going to start changing. That's going to make it more susceptible for these viruses to go around, whether they're flu virus or COVID virus. So you just gotta check with that. And another thing that's probably a thing that's lesser known is like pneumonia. Now, if you've had a pneumococcal, you need to check with your doctor or your immunization records. If you had, in most people's case, if you've had like as an adult, the pneumococcal vaccine, usually most places recognize that you may not need another one, maybe like every 5 years. If you're over 65, even if you had the regular pneumococcal vaccine, you may need to get the special vaccine that's for patients that's recommended for patients that are 60 and over. So you want to get that one. That's called usually the Prevnar. So you want to get that one, and then that one you usually get like every 3 to 5 years, depending on your health condition. So that's another one that you want to get. Now, I was trying to see, I know that you can have all of these at the same time if you want the COVID, flu, and pneumococcal. Definitely, there's been a lot of studies with flu and COVID, and it's been found to be pretty safe and pretty effective to have both of those at the same time. A little less with pneumococcal, not as much data on that. So that one, and you can, if you want to hold off on that for a week or two, that's fine. And another one is new that's recommended for patients that's over 60. And actually, we're at the pharmacy, we will start having that available next week for patients that are over 60. Is the RSV virus for the RSV virus vaccine. So that is RSV. You probably may have heard of it in the last few months, that last year that it really was broke out, especially among young children, babies, and young children under 2 years old. And most people, if people have RSV, they may have mild symptoms or may just feel like a cold. Most people get through it and probably don't even realize that they have it. But there's two groups that are very susceptible. They're having complications. One is young children. So that's why, we try to get them treated, try to get them as soon as they can, because of the breathing problems that could develop and can cause all sorts of other problems. And then also patients that are over 60. So if you're over 60 with RSV, and then especially if you have type 2 diabetes, again, you got all that inflammation in your body already. So you're already more at risk. So if you get the RSV virus, it can be more symptoms for you. You can experience more breathing problems, more other problems. So it's a new vaccine. This one you may want to check with your insurance first, see if it's covered or see if there's a copay. Because it's new, most people are not going to be aware of whether it's covered or copay or not. So you may want to check that out before you go to the doctor's office or you go to the pharmacy and get it. In some places, I know that you have to have a prescription to use it. I think in North Carolina, you can get it without a prescription at the pharmacy. We will have that available very soon, next week. I guess the first week in October for patients that are interested in getting it. So right now it's recommended for patients that are 60 and over. I don't know if insurance will cover it if someone is younger than 60. So again, you want to check with your insurance company before you think about getting the vaccine. But I definitely will recommend that vaccine for patients, especially diabetic patients, type 2 or type 1, if you're 60 and over, because you're more at risk of having complications. So that's something I definitely would recommend. Now, because it's new, there's not a lot of data on it, even though they said that looked at the CDC and they said you can have other vaccines with it, but there's not a lot of data on there. So, and they also saw that some people, when they got this with the flu vaccine, that it may have been a little less effective in treating both conditions. So I would recommend with the RSV that you definitely have that separate than the other vaccines. Like you may wait like a couple of weeks after, if you get your COVID and flu vaccine, maybe wait a couple of weeks after that before I got the RSV, just to make sure that you want to get it as most effective as possible. And since there's not a lot of data on co-administration yet, I would just be on the safe side and just get that, like probably separate that one out than with the other vaccines where there's more study and data on. Okay, so I didn't want to take up too much of your time. Just wanted to pass some information from you that is cough and cold season's coming up. I want us to be prepared. I want us to not be, not be afraid, but not at the same time put us unnecessarily at risk for hospitalization, because unfortunately thing with type 2 diabetes is that with the inflammation that's there, that puts us more at risk for complications for any of these COVID, pneumonia, flu, RSV. So if you're someone that falls in like over 60, you definitely want to try to have all of those. If you're under 60, you definitely want to have COVID, flu, and pneumonia if you're type 2 diabetic, just to protect yourself. When I'm getting mine, I'm going to get myself all stocked up before the end of the month, because I want to be really prepared for cough and cold season. So, and you never know how it's going to go. You never know. Some seasons are milder, some seasons are more. I know last year they said that less people took the flu vaccine. I think unfortunately what happened was that when COVID was really going on and before the vaccines really got to be massively available, and then we were doing like masking and washing our hands and doing that more. So the flu went down. And so now it's gone up, but not at the level that it was pre-COVID. So people don't really think of themselves at risk of the flu. But the flu is there, and the flu, the flu can be, can be bad. And then if we got a more communicable COVID virus out there, that may make you more susceptible for other infections like the flu. So you really want to go in and get that, knocked out of the way. The flu is readily available. Almost most insurances is covered, like no cost. And even if you had to pay out of pocket, it's not very expensive compared to other vaccines. So if you have any questions, please let me know. I appreciate anybody that listens to the podcast. Please spread this information out. I want to spread as wide and far as we can, because it can help somebody. I don't want to see anybody suffer, but especially my fellow type 2 diabetic patients. I want you to continue to be well, be striving, just being able to live your best life. And I really appreciate everything. And please, please, please. I'm just saying, like, if you're able to just go ahead and get these vaccinations done this month before cough and cold season comes about. And I want you to be protected. I want you to go strong. I want to see you. I want to see you, not read about you. All right. Well, thank you so much. And until we meet again, I want you to continue to be well and be blessed.